Hi, good day. My name is Massie-Ann-BSN from BSN2-WIEDENBACH. For today's video, I am going to show you the procedures about oral care for an unconscious or debilitated patient. But what is the definition? It is a special care of the teeth, gums, lips, and tongue of an unconscious or debilitated patient. There are 6 objectives. Number 1, to remove plaque and bacteria-producing agents from the oral cavity. 2, to allow the nurse to assess the patient's oral health status, knowledge, and routine of oral care. Number 3, to decrease the possibility of irritation or infection of the oral cavity and prevent sore formation. 4, to refresh and provide comfort to the patient. 5, to remove unpleasant tastes and odors from the oral cavity, thereby preventing bad breath or halitosis. Last is to provide teaching when appropriate. Now, let us proceed to the procedures.
Step number 1. Gather the necessary supplies. Preparation promotes efficient time management and provides an organized approach to the task. Step number 2. Explain the procedure to the patient. Explanation relieves anxiety and this facilitates cooperation. After explaining the procedure to the patient, perform hand hygiene and put on gloves. Hand hygiene deters the spread of microorganisms and gloves prevent contact with microorganisms in blood or saliva. After that, close the curtain or door of the room. Closing the curtain or door protects the client's privacy. Step number 5. Raise the head to a comfortable height. Lower the near side rail and turn the client on the side toward you, with the client's head tilted down toward the mattress. Proper positioning prevents back strain. Tilting the head downward encourages fluid to drain out of the client's mouth. After that, place a towel and emesis basin under the client's chin. Have a suction catheter and apparatus available if needed. The towel protects the client and the bed. The emesis basin and suction equipment facilitate drainage from the client's mouth. Next is to open the client's mouth and insert the padded tongue blade toward the back molar area. Never insert your fingers into the client's mouth. The tongue blade assists in keeping the client's mouth open. As a reflex mechanism, the client may bite down if fingers are placed in his or her mouth. After that, dip a soft toothbrush, cotton applicator, or another padded tongue blade in water, mouthwash, or diluted hydrogen peroxide. Move it back and forth gently across the client's teeth and chewing areas. Cleanse the roof of the mouth and the inner cheek area. Friction cleanses the teeth, and cleaning solutions aid in removing residue on the client's teeth and in softening encrusted areas. Next is to rinse the areas using a clean cotton applicator or padded tongue blade moistened in water. Suction any drainage if necessary. Rinsing or suctioning removes cleaning solution and debris. After that, apply water-soluble lubricant to the client's lips. Applying lubricant prevents lips from drying or cracking. After that, reposition the client. Lower the bed and raise the side rail again. Repositioning with the bed and the proper height and side rails raised provides for the client's comfort and safety. Next is to remove the gloves and wash your hands because hand washing prevents the spread of microorganisms. Last is to document assessments on the health record. Documentation provides communication and coordination of care.